September is Prostate Cancer Awareness Month. We here at St. Luke African Methodist Episcopal Church, Christian Education Department, would like to present Prostate Cancer Awareness. Basic information about prostate cancer. Cancer is a disease in which cells in the body grow out of control. When cancer starts in the prostate, it is called prostate cancer. Except for skin cancer, prostate cancer is the most common cancer in American men. Many men with prostate cancer, especially those with tumors that have not spread beyond the prostate, die of other causes without ever having any symptoms from the cancer. Overall, about 97% of men who are diagnosed with prostate cancer are still alive today, 5 years later. What is prostate cancer? When cancer starts in the prostate, it is called prostate cancer. The prostate is a part of the male reproductive system. Who is at risk for prostate cancer? All men are at risk for prostate. The most common risk factor is age. Some men are at increased risk for prostate cancer. What are the symptoms of prostate cancer? Different men have different symptoms. Some men do not have symptoms at all. If you have any of the following symptoms, be sure to see your doctor right away. Difficult starting urination, weak or interrupted flow of urine, frequent urination, especially at night, difficulty emptying the bladder completely, pain or burning during urination, blood in the urine or semen, pain in the back, hips, or pelvis that doesn't go away, painful ejaculation. Please keep in mind that these symptoms may be caused by conditions other than prostate cancer. What is screening for prostate cancer? Cancer screening means looking for cancer before it causes symptoms. There is no standard test to screen for prostate cancer. Two tests that are commonly used to screen for prostate cancer are PSA and digital rectal examination, also known as DRE. Should I get screened for prostate cancer? If you are thinking about being screened, you and your doctor should consider your personal risk factors and how you value the potential benefits and harms of screening, diagnosis, and treatment. What are the benefits and harms of screening? The goal of screening for prostate is to find cancer that may be at high risk for spreading if it is not treated, and to find them early before they spread. What are the possible benefits of screening, and what are the possible harms of screening? Well, the benefit of screening for prostate cancer may include the following: finding prostate cancers that may be at high risk of spreading so that they can be treated before they spread. This may lower the chance of death from prostate in some men. However, some men prefer to know if they have prostate cancer. What are the possible harms? The possible harms of screening for prostate cancer include the harm from screening, diagnosis, and treatment. Possible harm from screening, diagnosis, and treatment. Possible harm from screening include false positive test results. This occurs when a man has an abnormal PSA test but does not have prostate cancer. False positive test results often leads to unnecessary tests, like a biopsy of the prostate. They may have caused men to worry about their health. Older men are more likely to have false positive test results. The possible harms from diagnosis. Screening finds prostate cancer in some men who would never have had symptoms from their cancer in their lifetime. Treatment of men who would not have had symptoms or died from prostate cancer can cause them to have complications from treatment but not benefit from treatment. This is called overdiagnosis. Possible harms from treatment. The most common treatments for prostate cancer are surgery to remove the prostate and radiation therapy. Other common harms from treatment include accidental leakage of urine, erectile dysfunction or impotence, and bowel problems, including accidental leakage of bowel movement and sudden and uncontrollable urges to have a bowel movement. How is prostate cancer diagnosed? A biopsy is the main tool for diagnosing prostate cancer. A biopsy is a procedure that can be used to diagnose prostate. A biopsy is when a small piece of tissue is removed from the prostate and looked at under a microscope to see if there are cancer cells. A Gleason score is determined when the biopsy tissue is looked at under the microscope. If there is a cancer, the score indicates how likely it is to spread. How is prostate cancer treated? Different types of treatment are available for prostate cancer. You and your doctor will decide which treatment is right for you. Some common treatments are expectant management. If your doctor thinks your prostate cancer is unlikely to grow quickly, he or she may recommend that you don't have the cancer treatment right away. Instead, you can choose to wait and see if you get symptoms in one of two ways. Active surveillance, closely monitoring the prostate cancer by performing prostate-specific antigen, the PSA test, and prostate biopsies regularly, and treating the cancer only if it grows or causes symptoms. Watchful waiting. No tests are done. Your doctor treats any symptoms when they develop. This is usually recommended for men who are expected to live for 10 or more years. Surgery. Surgery is an operation where doctors remove the prostate. Radiation therapy is also a common treatment. This uses high energy rays similar to X-rays to kill the cancer. External radiation therapy is when a machine outside the body directs radiation at the cancer cell. And lastly, internal radiation therapy. Radioactive seeds or pellets are surgically placed into or near the cancer to destroy the cancer cells. Which treatment is right for me? Choosing the treatment that is right for you may be hard. Talk to your cancer doctor about the treatment options available for your type and stage of cancer. Your doctor can explain the risk and benefits of each treatment and their side effects as well. Side effects are how your body reacts to the drugs or other treatments. Sometimes people get an opinion from more than one doctor. This is called a second opinion. Getting a second opinion may help you choose the treatment that is right for you. All of this information in this video has been provided from the following: Division of Cancer Prevention and Control, and also the CDC, Centers for Disease Control and Prevention. If you would like more information, simply go to www.cdc.gov/cancer/basic_info/index.htm. Thank you so much for joining us on this broadcast concerning prostate cancer awareness. Look for more information in the future coming from St. Luke African Methodist Episcopal Church, located in Opelika, Alabama, where the Reverend Monique is the pastor, and the Christian Education Department, where Sister Elaine Burton is the Christian Education Director.